Breast reconstruction is performed typically women who have decided to have mastectomies for treatment of either their breast cancer or genetic concerns of developing breast cancer in the future. Techniques in regards to breast reconstruction involve either using your own body area, so kind of take from Peter to pay Paul. One of the more common areas that we'll take tissues from the lower abdomen. Sometimes we can do that without taking any muscle. We can also take tissue from a person's back. And on special occasions, we can take the skin and the fat and the portion of the buttock muscle, or even just the skin and the fat from the thigh to reconstruct a breast. The other technique involves using breast implants. Typically we have to put in it's called a tissue expander, which is a specialized device that's then expanded to create the pocket to then come back in a second operation and put in a permanent implant. Oftentimes we can do breast reconstruction immediately following the mastectomy. So a woman would be under the same anesthetic, have the mastectomy, and then the reconstruction be performed. Occasionally we'll do delayed reconstruction where the mastectomy is completed, and then at a later date the reconstruction can be performed. There's definitely women who've had mastectomies who've decided after the fact that they wanted to have reconstruction, and those can also be done. We can do nipple reconstruction. There's basically two general techniques. One's a surgical approach where we take the tissue overlying the breast mound and reform the nipple and then subsequently have tattooing. Another approach which some women may elect is to just undergo the tattooing in and of itself, where there's no surgical creation of the nipple, but the appearances of the color difference of the areola and the nipple. Decision about which approach for breast reconstruction is really a decision that's made between the patient and the plastic surgeon. Part of it has to do with the person's body habitus. Part of it has to do with the treatment for any cancer. In general, radiation treatment puts a person at a much higher risk of having complications with tissue expanders and implants. So those patients oftentimes will benefit more from having autologous reconstruction using their own tissue after the radiation has been completed. A typical recovery from breast reconstruction varies on the technique. Definitely it can be one of the more prolonged and complicated reconstructions. So a woman who's having autologous reconstruction from her abdomen, we'll be looking at about a 4 to 6 week total recovery time. With tissue expanders, it'd be a little bit less than that. Typical recovery, or maybe 2 weeks, and then you can resume most of your activities. Northland Plastic Surgery offers a full spectrum of reconstructive procedures, both autologous reconstruction, like we talked about with tissue from your abdomen, back, buttock, tissue expanders, implants, all the way through nipple reconstruction, and we do all the tattooing here by our staff. One of the most rewarding parts about breast reconstruction is it can be a fairly prolonged process. The expansion process typically takes about 2 to 3 months, and then you're looking at another operation. So it is one of those reconstructive procedures that we have a long-term relationship with the patient. It's not just kind of one and done. And so seeing those patients repeatedly over time, going the whole journey from the diagnosis of breast cancer, the decision to undergo a mastectomy and reconstruction, and then at the final end of the process when the reconstruction has been completed is very rewarding.